Thank you very much. Ms. Fudge, you're recognized for 5 minutes.
Thank you very, very much, Madam Chair, and thank you all for being here today. You know, it's just interesting to me that anytime the majority doesn't like something, they just deal with it ad nauseum over and over and over again. You know, we have voted more than 60 times to repeal the Affordable Care Act. They didn't even pretend to have a replacement, just repeal it. What would make you think they have a replacement now? This is nothing more than just stalling till they can come up with a plan. They have no clue what to do to replace it. As a matter of fact, the president said it's just complicated. It's just complicated. I know it's hard. 65 times with no replacement plan. You know, I listened to the chairwoman talking about people coming to town halls. I had a town hall on Saturday because I know that when I was elected to represent every single person in the district I represent, even those who disagree with me. That is my job. And so I listened to what the people said. There was not one who believed that we should repeal the Affordable Care Act. Can we make it better? Absolutely. They want it fixed. They don't want it destroyed. But what we want to do here is to destroy it because we have no earthly idea how to fix it. I wonder how many hearings we're going to have on this. They didn't like the NLRB. We had 26 hearings. Wonder how many we'll have on this before they come up with a plan. Ms. Mitz, even though we've not talked about this today, they have this great idea that health savings plans is the answer to all of our problems. Could you please talk a bit about how someone, maybe with cancer, or someone who has some long-term illness would go into absolute bankruptcy with a health savings plan?
Thank you for your question. Health savings accounts do not work for the vast majority of working people in this country, middle-income families who are living paycheck to paycheck. Basically, it asks people to pay full freight for their health care. They're tied to plans with high deductibles that data has shown, research has shown, that most families do not have that type of money in liquid assets and any financial assets to pay $2,000, $3,000 in medical bills. So health savings accounts are not the solution for working families. They just cannot afford to put that money aside in an account where literally they cannot use it for anything other than health care. They have an emergency fund for health care, for their house, for their children. And so it's really not a solution, and it's a cost shift to families. And would leave them exposed to bankruptcy, medical debt.
Even though some people think we live in an alternative universe, I don't deal in alternative facts. It is a fact that 20 million more people have health care because of the Affordable Care Act. It is a fact that people are no longer going into bankruptcy because they are sick. It is a fact that young people can stay on their parents' insurance until they are 26. It is a fact that right now, a person who is sick can get help and not have to worry about paying their bills. So let's just deal with some facts. What happens if we restrict or reduce the amount of Medicaid expansion in our states? What happens to these people who now have insurance, who after we change whatever it is they're going to change, because I still don't know what that is, what happens if we roll back Medicaid expansion?
Medicaid expansion has expanded coverage to millions of working people in this country. The majority of people who have benefited from Medicaid expansion are working adults. They would be left without any affordable coverage option and likely go uninsured. We've seen people's access to preventive care and primary care improve thanks to the Medicaid expansion, and that's benefited, enrollees of the expansion, as well as their workers who now have a healthier workforce coming into work every single day. Rolling back the Medicaid expansion would have dire consequences for states who have seen an economic boost from the federal funds coming in. It's created jobs and lifted up their economies. And so the cuts have dire consequences for the low-income people who have relied on Medicaid for affordable coverage, as well as their states.
Thank you for just the facts, Bam, just the facts. Thank you. I yield back.
Thank you, Ms. Fudge.